thank you, Prime Minister, for inviting me here tonight to share with our nation our plans on reopening our borders. I thank you for giving me the opportunity to serve in these trying times, and specifically for the latitude you have given the health professionals in addressing this pandemic under your leadership. The fight against COVID-19 pandemic. The decisions we took with COVID-19 at the beginning of this pandemic were totally for health reasons. We successfully flattened our curve, contained the spread of the virus locally, and did not overwhelm our health system. We were able to boast of our Federation's results in handling this pandemic with 0 deaths thus far and no positive cases for more than 5 incubation periods after the last of our 15 original cases were recovered. This was one of the longest of any nation on the face of the earth. We emphasized the adoption of the non-pharmaceutical measures that were needed for the success that we saw. And they cannot be overemphasized. Social distancing, staying at least 3 to 6 feet from others, wearing masks in public places and around others, hand sanitizing, and cough etiquette. We adopted an all-of-society approach towards the fight against COVID-19. We were alert and aware and responded rapidly and effectively, and were therefore able to contain the virus. We thank you, the public, for listening and cooperation. It was because of your personal responsibility that you took that led to our collective success as a nation. I also at this time want to thank all of the frontline workers, including all of our healthcare workers, the nurses, doctors, the emergency medical officers, and the police for the work that they did in fighting this pandemic. Now, where are we now with this pandemic? Some of us began to get complacent as we went a couple of months without a positive case. We were in fact COVID-free for about 70 days, but we warned that this was only temporary. As long as persons are returning to the Federation, there will be a risk of the virus returning. Our borders were closed to international and regional commercial flights, but our citizens were still allowed to return on special charters. The virus is also still out there with no signs of slowing down, and some countries are struggling to contain their first wave. As of today, globally, there are over 13 million confirmed cases and more than 500,000 deaths. In the United States, there are more than 3 million confirmed cases and more than 136,000 deaths. Here in the Federation, we had 17 confirmed cases, 15 recovered, and 2 active now. The virus is not going anywhere, and the reality is that we are going to have to learn to live with it. We, however, cannot afford to drop our guard and become complacent, as I saw happening over the last few weeks. These new cases should serve as a wake-up call for us. When will we open our borders? We keep being asked the question as to when the borders will be open. This question is continually being posed to the health officials. We all have to be aware that any lifting of the borders will come with a risk of the importation of the virus. If we are to aim for 0 risk with the virus entering the Federation, we will have to wait for an effective vaccine and immunity of our population. That will not be for another year with the most optimistic expectations. It is neither realistic nor desirable to aim for 0 risk. 0 risk will require continued closure of our borders and the concomitant economic hardships that will come with that position. We cannot survive the virus but die from social and economic hardships. The questions to be asked are, how long can we survive economically and with continued closure of our borders, bearing in mind that tourism is our major income generator? What level of risk are we willing to accept in opening our borders, and what measures can we put in place to mitigate these risks? How to learn to live with COVID-19. It must be clear to all that as we attempt to get back to some sense of normalcy and generate social and economic activity in our country, that we will have to live with COVID-19. We got your support in successfully containing the first wave of the virus, and we are calling upon you again to fight in the second wave to contain the virus. This has to be an all-of-society approach for us to be successful. This is not merely a health decision, as some believe. What does the World Health Organization say on this? The World Health Organization clearly stated that each country should assess its risk and rapidly implement the necessary measures at the appropriate scale to reduce both COVID-19 transmission and economic, public, and social impact. The World Health Organization also warns that there is no one-size-fits-all approach in managing COVID-19. We therefore need not adopt policies of other countries that are not appropriate for our size and scale, which could lead to overwhelming of our healthcare system. What COVID-19 protocols have we used for the repatriation of persons here? As it relates to protocols for reopening to visitors, the approach with the least risk from a medical standpoint is the one that we use for the repatriation of the students just recently. And it involves 1, a negative PCR test 72 hours before arrival, a PCR test on arrival and isolation if positive, quarantine for 14 days and retesting at the end, and released at the end of 14 days once negative. This model will work only for long-stay visitors, but will certainly not be ideal for the short-stay visitor. What are other countries around the regions doing, for example, Barbados, and what can we learn from them? If we look at the main basics in the Barbados model, within 72 hours to 1 week prior to departure, all travelers from high-risk countries are strongly encouraged to take a COVID-19 PCR test from an accredited lab. High-risk countries are defined as those with more than 10,000 new cases in the previous 7 days or community transmission. Low-risk countries are defined as those with less than 100 new cases in the prior 7 days and no community transmission. Travelers from low-risk countries who have not visited a high-risk country within 21 days prior to arrival are exempted from the testing requirements. Travelers who came in without a test would have to have a test upon arrival and remain quarantined until the result is produced. This protocol does one of two things. It assumes the risk involved in allowing the free movement of someone from a low-risk area into a country. Coming from a low-risk area does not eliminate the risk of one carrying the virus, however. It also assumes the risk of importation of the virus with a negative test 1 week out. But we all know that someone can test positive 1 day after testing negative. Now, St. Kitts is considered a low-risk country, and the reason for this is because we did what needed to be done very early. We closed our borders in a timely manner and contained the virus once it got here through our robust testing, contact tracing, quarantine, and isolation programs. We will have to absorb some risk as we attempt to open our borders and generate economic activity, but we must do this very cautiously if we are to remain in the category of low risk. Our protocol for reopening our borders will therefore contain a number of elements to reduce the risk of exposure of the virus in our country, but it cannot totally eliminate the risk. And the things that we'll have within our protocol, we would have at least 2 categories, a low risk and a moderate to a high risk category when we're looking at persons coming in. We will use the gold standard test for screening persons, which is the PCR antigen test. We have no plans to use the rapid antibody test in our protocol, as at present the sensitivity and specificity of the current antibody test are questionable. A negative PCR test will be required before entering as part of the protocol. A completion of a pre-arrival health screening form will be required. There will be health screening on arrival, including temperature checks. Serial testing after arrival will be part of the protocol. A period of quarantine will continue to be part of the protocol. Quarantine site categories will be looked at, including certified hotels, pre-approved home quarantine, government and other facilities. We'll also be utilizing an app for tracking persons that has geofencing capabilities, the capability of contacting persons and managing them in real time. The app will be mandatory for all arriving travelers, and we'll obtain consent to abide by our protocols before arrival. And persons who are coming will have to abide by our emergency powers regulations. We also need to prepare for reopening with training of persons in tourism industry, including hotels, restaurants, bars, tour operators, taxi drivers. This will be done over the next few weeks in collaboration with the Ministry of Health and the assistance of the Pan American Health Organization. We have a map that allows us to control the disease, but yet get on with our lives in the new norm. So in summary, the decision to reopen is not solely a medical decision, but should be guided by medical advice. Economic and social activity must be considered in making the decision. There must be public education and buy-in as we move forward, as it has to be an all-of-society approach. And your individual responsibility is germane to our collective success. We will continue to refine our protocol for reopening to ensure we take on the least risk, but allow economic activity and not overwhelm our healthcare system. I thank you.